guys? Dr. Dan back in the house with Daniel. So Dr. Dan, then we got young student Daniel. Daniel is how old now?
16.
16. And what grade?
Going to my junior.
Junior year. What sports?
Soccer, golf, volleyball, tennis. So
Lots of activity.
yep.
Lots of working out. Grew up a whole bunch the past year, 2 years, and has been through some kind of significant injuries. One of the major ones was the right shoulder injury, which was last summer.
Spring 2021. Yeah.
And why don't you tell us about what happened?
Playing volleyball, dove for a ball, landed my shoulder, popped it out.
Dislocated the right shoulder?
Yeah, I think I slightly tore the rotator cuff. So.
And then what was your advice when you first went to the... Did you go to the ER?
Yeah.
Yeah.
Well, they thought I was gonna be out for the season, so I was like, I kind of want to keep playing. It was my first year playing volleyball in general. So then I kind of came here, asked you what to do, and worked it every day, and then...
Whoops. Wow. Sorry. Dislocated the shoulder, went to the ER. ER says, you're probably going to be out for the season.
Yep.
Came in here, I think, maybe a day or 2 days after you dislocated it, right?
Yeah, I think it was the following day, yeah.
And right away started our rehab protocols,
Mm-hmm.
and you went back to playing a week or 2 weeks?
I think it was two and a half weeks later.
2.5 weeks.
Because I managed to play the last 2 games.
So don't let a season-ending injury be told that it's a season-ending injury unless you get a good second opinion from a solid chiro or a physical therapist or somebody that's a body specialist. In the ER, they don't know any of the rehab that we do. They don't know any of the body posture, the coiling, the position work that we want to do. Daniel here has been working on stability in the shoulders, lots of back chain strength to help gain flexibility, but also stability, strength in the glenohumeral capsule, the rotator cuff muscles that wrap around from the scapula out to the front of the shoulders. And just a small ongoing issue with Daniel is that he still gets a little bit, like this side's soft on the left, but feel how you're still holding a little bit of tension here on this like right side.
I think I threw this arm out like 2 weeks ago, so.
Doing what?
Just a lot of football, so I guess I play football too.
Are you playing on the team this year?
I'm probably gonna kick next year. I'm just gonna practice to the side this year.
Nice, man.
Yeah.
So what we notice on Daniel is that, and this is kind of like consistent, he comes in every now and then for a tune-up, and today we got him on video, but he's got a pretty cool history. He's moved and learned how to run in the pattern that we teach over in the gym, which is awesome. Pretty fast athlete these days. And hands behind you. Shoulders open. Lean back. No neck tension. Correct. Left side's good. Try to get this guy a little lower like that. Verse left side, sorry. Lower with the shoulder blade. Correct. A little bit of power down into here. A little bit of power down into the right side. A little bit of hone in down here and try to kind of seize it up or cramp it a little bit. And then a little bit on the left side with the left shoulder down out of the neck, correct. So feel how you press through the hand there with the softer neck. So we gotta think soft is smooth, smooth is strong on the right hand. We gotta think soft is smooth, smooth is strong on the left hand, which means a low left shoulder, there you go, perfect. With a little bit of press down through the hand so that we originate the power. We turn on the power, we originate, meaning we create the power here, and we get the arm, the tricep nice and long. Back to the center, back to shoulders open, nice work, back to hand press, and left elbow, right elbow tall, beautiful. A little twist left, so he can mindfully start to feel his coiling system. A little twist right like that. Is that cool? Got to make sure we do that. And we do that also, right? Then we take the tension out of the neck. You guys saw how he lowered his shoulders nicely. Now he's a little bit softer and he's more powerful down in the base. Cool? All right, take a break. So on camera, you guys have an option. We all have freedom in our healthcare, which is awesome. Freedom in our healthcare to choose a provider and definitely get advice from maybe the ER, and the ER says, oh, you dislocated your shoulder, you probably have a season-ending injury. And then guess what? We come in, we get him in the gym a little bit, do a little bit of workout with him. His shoulder's okay. We start to build some stability, create trust up in the brain. His brain's got to trust his shoulder again, especially after it pops out of the socket. Ligament laxity and tendon laxity, or stretch. Everything gets real stretched. Great exercises you guys have seen on all the appointments, how it builds back chain strength. If I say push chest forward, like that, and now light flat hands, shoulders back, forward through the tips of the fingers, and soft activation through here. And then a light twist left and a light twist right? And we're going to hold each side for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, then right side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, left side. 5 reps each side. You can go up to 10 reps for 10 seconds each. But we just want to turn on the brain and get it powerful back here. Cool? All right. So we've got, and look down here. So in the clinic, guys, we got 2 areas that we like to work on. One, definitely the acute injury, the acute, rip, tear, strain, back pain, neck pain, whatever. I tweaked this and I hurt this. And my one doctor told me to rest, and the other doctor told me, like me, get back to exercise. If it feels okay, do it. Movement is life. Movement is motion. Motion is necessary for healing. Motion creates blood flow. Good motion. Can't be doing poor motion. Poor repetitive stress injuries develop. Tendon and muscle injuries. We got to work this big kink out right here, big guy. You feel that in there? Yeah. So we got to be proactive in our healthcare. We got to be proactive in our own choices, right? I want to get back to playing sooner, so I might try to see, this chiropractor out, or this physical therapist, or this massage therapist, or whatever. Find somebody that can coach you through good exercises, good movements, and ultimately develop more mindfulness in your body so that you can develop trust and safety and security up in your brain. You can be confident with every step that you take. And Daniel knows how his run has improved, right?
Yeah.
Man, I found your old run video, which we have to do a comparison, which was not bad to begin with, but bro, your beautiful run now. Powerful. Look down. Look up, look down. And way left, good. And now hold right there. Good. Now we're going to go lean right and lean left. Lean your head left now and pull through that. And lean right and lean left. And lean right and lean left. Lean right and lean left. Lean right, lean left. Lean right. And then another important topic, Daniel's family and Daniel himself have chosen to be proactive. We just talked a little bit about proactive healthcare. Chosen to kind of like make a little bit frequent chiropractic care part of their health routine. Not running around the world with constantly kinked up neck and stressed upper back and pain, and can't compete in this sport this year because I got this injury, and I can't compete in this sport, or I can't do this event because I've got injury. Being proactive, moving well, moving super well, learning how to move well, mega important so you can achieve athletic performance and also injury reduction, right? Shouldn't have non-contact stress injuries, patellar tendonitis, Achilles tendonitis, rotator cuff issues or tendonitis of the shoulder, where we're just moving incorrectly, our body's imbalanced, we develop aches and pains in different spots, and so many times, more times than not, 9 times out of 10, whatever, people say, I hurt this playing high school football, and my knee hurts from lacrosse or whatever. Are you doing enough stretching at home, enough exercising at home? Are you keeping your feet straight, your spine balanced? Daniel knows all about that stuff right now. Are you activating your back chain frequently throughout the day so you can have healthy shoulders, healthy posture, healthy back chain activation, so we can improve circulation, reduce tightness, and just get the body better. Let's go hands back on hips now. And light shoulders down. Good work. Hinge forward. Bend, bend, bend. Arch upward. Now lower elbow. Yes, good. Hold right there. Feel how you took the tension out of here. Feel how you have light power back here.
Yeah.
That's good that you pinched more, but now lower a little bit. Nice. And now if I say hunt for the right palm and the right elbow down. No, don't lean into it so much, but yes, correct. That little shoulder blade lower. Try to do that on the left side. That side's a little easier. Lower. And then just back to center and soft rest down and open, like that. And open is back and down is down. Correct, hold right there. See how that position feels. So learning the feeling is something that we got to coach everybody through, is just learning the feeling that we're softly engaged down through here. Back's nice and extended. A little bit of press through the palms helps us light up the triceps. So if I say right palm pushes, try to really get this tricep to bear a lot of weight. Pull the shoulder back a little bit. Good. And feel how tight this is. Right now his triceps pumped up. He's got super tight skin. His triceps holding a ton of weight. And then left side. Nice. And if you focus on the palm press enough, you're going to get a little strain or maybe a little cramp or a little power. You're going to feel power back here. Yeah. Make sure we don't clench our jaw, tense our neck. Gently think, can I lower this a little bit more? Perfect. Can I push this a little bit more? Nice. Can I feel how that powers up the back? And maybe I want to stretch my neck away from it. And maybe I want to feel this nice, beautiful stretch up through the side of the neck. And then you guys will see with the right side. Let's set them up, keep those there. And now stretch the neck to the left. Chin tuck back a little bit. There you go. Lower this down. And now a little bit of hand pressure into the bum or the hip and a little lean to the left. Feel how that pulls up here? Yeah. So we want to decrease this tension. If we coil it, coiling it is going to be like here to here to here to here, which is going to be right shoulder down, then left shoulder down, left neck stretch. 5, 4, 3, 2, 1, then right side. 5, 4, 3, 2, 1, then left side, then right side. And then back to center and soft double open with down. Correct, perfect, dude. Now we got super soft neck. I think I just heard a little pop up there. And just with a little bit of movement, we're firing up good back chain muscles. And he's going to decompress his neck naturally. He's also going to help his AC joint, the acromioclavicular joint, where we get tension that builds up. And when he had his, when Daniel has dislocated shoulder, tons of pain, tension, irritation over the right shoulder, but went away very quickly enough that he was allowed to finish the last 2 games of the season last season and not have ongoing worsening right shoulder problems. He's done his rehab. He trains in the gym effectively and efficiently. He knows his body well. He's learned over the past year or 2 years how to cut nicely, and now it's just going to be more progress, more athletic performance, more gains when we weight lift, we exercise, we run, because we put more reps in, more time into it, so we get better at it. Cool? All right, let's go face down for me. And you guys, if you're a chiropractor, if you're a PT watching, or a masseuse, good to do an assessment. An assessment is just or even just a little passive stretch down here for the legs. I like to twist toes in a little bit, and anytime I'm doing this, I'm making sure that I'm standing in my back chain, and I can work a little bit on some cuts left and some cuts right, as we just kind of passively straighten his knees out, working a little bit on an Achilles stretch, a Gastroc Soleus stretch, as we just kind of pull down with a little bit of toe in. Does one leg feel tighter than the other leg?
The right one.
The right one is tighter down here. See how it feels like that? Boom, boom. This is a little looser. This is a little tighter. Mm-hmm. Let's check the flexion of the knee. Good. Now push into my hand. And stop. Piece of cake. Push, 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 push. And you guys have seen on other videos how some patients shake pretty uncontrollably here. Daniel has very mild shake through the leg. Relax. Push. You guys just heard the little knee cavitation or the little knee adjustment. And stop. And push. And stop. Nice. And now we'll do toes prone today. Let's relax foot. Back down. End up here. Now push here. And stop. And push. And stop. And push. And stop. And guys, when I do the PIR or the stretch here, I like to get kind of mimicked into what you see in the rocker position. We like to get the heel out and away, but we also like to test. How's that feel right there?
It feels good.
Pretty good, not too tight.
Yeah.
Now he does have a little restriction in the top side of the ankle. Which we'll see if we can get the ankle to adjust today. And we'll get the toes face up. Sometimes they all go nicely on the way down on the front side. All right, here. Then we do a little SI joint or a little pelvic decompression. Just some light pressure to feel how the left hip feels versus the right hip. How's left side feel for you, buddy?
Pretty good.
Pretty good? And any pain or soreness over here?
No.
Awesome. All right, deep inhale for me, dude. And exhale down, whole way down. 1, there it goes. 2, good. Breath in. Exhale down. We're 2 levels, there goes 1. Good. Breath in. And exhale down. Oh, piece of cake. 1 more in. And exhale down, whole way down. Oh, piece of cake, man. All quiet adjustments, all Daniel's spine. 3 or 4 solid pressures. And when I shoot for adjustments, guys, you know, some chiropractors say, you got to be very specific and just hit the vertebrae that needs adjusted. But what I have found is that with exercise and back chain dominance and foot balance, there is always a primary injury, a primary neck injury, a primary mid-back injury or something in the low back. There's always a primary, and then, you know, you might have, in his case, right neck, might be like left mid-back, right mid-back, left low back, right SI joint, something like that. Problems jump side to side. So we have this right neck injury. We're more prone to have right shoulder dysfunction, which Daniel has a little bit of right here. Feel that thing right there, buddy?
Yeah.
Now we just loosened it up into extension, but now we need to see if we can get it into rotation. And this is where the CT junction comes into play at. And he's got a C6, C7 on the right, and then a T1-2, and maybe even down into 3 on the left. So let's go, hands right here for me, dude. Tilt. And now left side gently on the left. And 1 more there, centered. Tilt this way over. Let me see if I can get this here. There it goes right there, nice. Did you feel that in there, huh?
Yeah.
Face over window, right side up. That was a little bit different of a CT adjustment, and usually I do the thumb spinous process, but sometimes you have to get into like the palm on the transverse process to get it to rotate a little bit. Breath in, roll, exhale, and easy. Nice, other side for me. Great adjustments all around, man. Right here, cross here, breath in, breath out, whole way out. 1, 2, flat on your back for me. Dude, this right foot's wonky today, buddy.
Yeah.
What's going on, man?
I have no clue.
Let's see what we got. What we couldn't get. Nice. Relax toes. No ankle. All right, scooch up high on the table. Right there. Cool. Now I know your head's off a little bit. All right, so Daniel today has some wicked front chain tension, which is preventing him from getting a little bit more back chain. And what I mean by that is that this right ankle, both ankles are a little restricted. He's just not plantar flexing well. So point your feet down, twist your knees open gently, right there. See how that's already a little shaky? So I need you to lay in bed at night, and if you guys go ahead, squeeze gently down through the toes. Try to relax your quads. Good. That's where I want you to go. Make sure you're not all tense in your upper leg. Hold right here. And now just give me a little bit of right knee open a little bit, and a little bit of right foot squeeze. And a little bit of right foot point with right foot squeeze down. So reach this guy, yeah, like that. Gently kind of hone in and try to feel this, maybe the calf a little bit, maybe the inner leg muscle. Maybe up into the hip you'll feel it's twitchy, twitchy, twitchy. See how twitchy that is up there? So you want to focus on this double bow set lying down. And then a little bit of left foot focus. See how both hips are kind of twitchy up there? So I want you to lay in bed at night and I want you to think, can I point my toes down? Can I twist my knees open? Can I feel how that stretches my hip out and maybe activates my leg muscles a little bit? Can I feel how my right knee needs to open up a little bit more? And you're going to feel how that right hip's your weaker hip compared to your left hip. Does that make sense? Yeah. Okay? So all I need you to do is connect your brain to your left foot, your left knee open, and then your right foot, your right knee open. And really work this right side because we need to get some flexibility back in the foot. Now, what else I can do is a little bit of myofascial work. Up and down through what we call the peroneal compartment or the anterior compartment of the leg. That was my knuckle. And what we're doing is, this is where you guys get shin splints at if you ever had shin splints. You can have anterior shin splints or posterior. And posterior means on the back inside of the leg, or posterior tibial tendinitis it's called. But you can also get anterior shin splints, which are out here on the lateral leg. You okay down here? Not too bad? Good. And especially right on the side of the bone, the leg bone right here. Right on the tibia, the tibial. Right through the tibia and the fibula right here. Good, relax down for me. Good, twist knees open gently. Nice work right there. Light toe squeeze down. Left toe squeeze down. And right toe squeeze down, okay? So you guys, we talked on one video, if you watched one of the previous ones, or maybe it's coming up, but we want to create curves in the body. We want to create plantar fascia curves. We want to create foot curves. We want to create leg curves. We want to create spine curves, right? We want to move in a fluid movement, a little drop in release, a little drop in release of the foot. When we lie down, we want to do our double foot presses, which Daniel's got work here to do. You're not doing this enough. See how that kind of feels up in the legs and the pelvis? Feel in the calves too, maybe down in the inner legs a little bit. You may get some lateral calf cramping or straining as well, okay? In this position, I want you to just gently keep your heels and your feet touching, but straighten this knee back a little bit. And hold that for like 30 seconds and focus on how that's weak or twitchy right through there. And then let's focus on left knee straight back a little bit, lock it out a little bit. And compare and contrast right side versus left side. You may notice right side might feel a little weaker. I don't know if it does, right? So we want to make those upper leg, up in the hip muscles a lot stronger, so we got a more stable pelvis, but we got fluid movement down into the feet and the ankles. And this is a beautiful way. He's straining his calves a little bit, working on his left quad, working on his right quad. If we go back to center, we twist both knees open gently, and we work on the pelvis, right? Feel that like up in the adductors, these guys up here. Cool? All right, take a break. So those are a couple things we want Daniel to do on a nightly basis. There goes ankle. All right, not that one today, but that's the stiff foot. So he's going to work on this. We're going to see him in maybe 2 or 3 weeks to follow up. He's going to work over the week, over the weekends, a couple minutes a night in bed at night. Relax this hand for me. And thumb, or finger, index, middle, ring, hand, pinky. Nice. Elbow. Elbow, elbow. Nice work, big man. Hand here. Relax hand. We're going to start pinky this side. Ring, middle, index, thumb, and then elbow. All right, good. So in the fingers, guys, you'll see me most of the time adjust in a little decompression fashion like this. Also good to hit the knuckles underneath. And you can do a lot of this yourself, but not bad to flex the knuckle and kind of use your opposite hand. Hold right here for me. Use your opposite hand to hit this joint or this joint, right? So you got your distal joint and then your proximal joint. And if the distal joints, which is this joint here, needs it, it'll pop. And if it doesn't need it, it might just feel like a nice little stretch. Pinky usually needs it. There it goes. And then pinky under, right? You can kind of just quickly go through right hand, thumb, pinky, ring, middle, index, and then you want to do the opposite, which is extension. And you can kind of do both hands if you want to do both hands. Prayer sign press is here. Prayer sign press with wrist extension up through here. So we want to be that 90-90 position. 90 through the hands and 90 through the wrists like this. And this is a nice position to start to practice on developing. You can keep thumbs together and pinkies wide like this, but kind of tucking down and in or up and out like this with the elbows. Good mobility work for the wrists and the fingers to help kind of just get some fluidity back into the system. Daniel's neck adjustment. He's a quiet adjuster, but we are getting things moving. Easy on the left. Let me lower this a little bit. Good. Easy on the right first, right shoulder down. And one more on the left side here, on this left side neck. There it is. Now right side neck. Shoulder down on the right. All right. Hands on thighs. We want to have wide fingers. Hands press, shoulders roll. Daniel knows this one for back chain activation. But what we want to tie into him today is a little bit of right side focus. So we're going to tilt the head to the left, push down into your pillow at home. Try to focus on the right arm crawling down. And just try to get this stretch up into this right side neck right up here. Do you feel how it pulls up there? It feels kind of uncomfortable, right? But what we need to do, we need to create some tension throughout the system. We need to stretch the irritated and inflamed muscles up here. We could do some laser on the neck. We already did a little muscle work to help stimulate some of the musculature up here, getting some blood flow and working on some reduction of tension up in the neck. We can turn over here a little bit, press down, feel that kind of just like lights this whole thing up, right? In your right hand, it's like, can I crawl down a little bit and increase that tension even just a little bit more? And just focus on this for like a minute or two, or maybe even up to 3 minutes of just reduction of tension up here, whether we turn left or we turn right, or we tilt a little bit more and we pull a little bit more and we open all this up. Is that cool? Yeah. All right. Sit up tall for me, dude. All right. Last little movement today. Both shoulders moving nicely. Let's see if we can get a little cavitation out of them. just to get a little blood flow. Nice, there's a little baby one over here on the left. And good, all good. Clavicle. Good, and left clavicle. Good. All right, name of the game today, hands back on hips. Light elbows down, light shoulders down. That's the soft rest I want you to work on. And I want you to hunt for a little bit right shoulder down, and I want you to hunt for a little bit of left shoulder down. And add the neck stretch just like you're already naturally doing. Work on that tension on the right, work on the tension on the left. Got it?
Yep.
Cool. So no matter your age, young, old, student athlete, non-athlete, injury, no injury, definitely after injury, acute chiropractic care, muscle work, correct body positioning, placement, stability, and mobility exercises are going to get you guys back on track, moving quicker, faster, and ultimately living up here a little bit more so we can control the body better. Thanks for coming in today, dude. I'll see you in 2 weeks. I'll see you guys on some future videos.